Ooh, yeah, you hear that? You can see I just adjust somebody's wrist, and if you have any wrist pain, any similar reaction when somebody touch your wrist, and weaknesses, we'll dive right into it today. And we not only talk to you about how the pain started and how to prevent it, but more what to do to fix it. So if you're interested, just keep watching and we'll get to the answer. All right, hello everyone. My name is Dr. Tran. I'm a chiropractor and founder at Optimal Chiro-Rehab Center. And today we're going to talk about the wrist. Well, so I've been practicing for 18 years. And over the years, I realized that some of my patients doesn't realize that I treat more things than just the spine. And especially the wrist and the knee and different joint. And why would you go to chiropractor to get your wrist pain? So today I'm going to talk a little bit about anatomy of the hand so you understand why chiropractor can help you for your wrist pain instead of surgery. Now, I'm not saying surgery is not important. Some cases you need to have surgery, but most of the time you don't need surgery if you understand how you injure your hand. And most of the wrist injury and hand injury are from repetitive trauma. I call micro trauma. When you think about trauma, you think about accident, you think about big injury. No, it's the thing that you do the most every day. So for example, for a person who uses computer all day long, the typing, that's create tremendous amount of strain on your body over time. It doesn't look like a lot when you move this finger, but you see it, I move my finger, you see all the muscle moving from my elbow here. So because it's so small, 5 movement, you can do it continuously, but over the year, they add up a ton of stress. If you rather go out there and let's say digging dirt, doing farming or chopping wood, you cannot do continuous for a few hours. You might have to do 30 minutes and you take a break. But typing, you can typing for a long time, or holding the phone, for example. Or like say mechanic, like you use the same motion over and over again. That's what we call repetitive trauma. So the way the injury come is as you start using the muscle, right? Lactic acid buildup. It's just like you turn on the engine in the car, the smoke came out, carbon monoxide, that's trash, that's toxics, right? But for the car, it evaporates to the air, it dissipated. But for our muscle, the lactic acid that you accumulate from uses of muscle, it stays in the muscle. And that's what causes muscle tightness. So the amount of lactic acid build up, let's say for 16 hours a day, and then you go to bed, you sleep, if you're lucky, you sleep 8 hours, right? So think about it, you have 8 hours to clean out the trash you put in that day. But you work for 16 and you only sleep for 8. You have 8 hours of additional trash every day. And you build up over years and years and years. That's why it gets tighter and tighter and tighter. But that process is gradually changed. You might not see it. That's why, but slowly, think about it. The wrists have different motion, right? All this kind of movement. And if you was like me, when I was little, I played a marble and something like that. We move the finger all the way. Well, think about it. How many of you now pull your finger back like this and you don't feel pain? So the range of motion slowly reduce over time, but we never associate that with the discomfort or the pain you have. And the other thing is you have 27 bone in the hand. Just this wrist only, you have 9 bone here. How many of you know that? But that's why we can move all different places. However, as you start using the hand, lactic acid build up in here, cause stiffness, and slowly it tighten up and it lock up this joint. So if one of the joint, go out of place and stuck, you might not have any pain, but you don't feel comfortable to move that way, so you start moving it. Now, if you don't use that joint, you don't move that particular direction, that joint slowly dying. But then during that process, you might not have any pain. And then one day, out of the blue moon, all of a sudden you start having numbness, having pain, and you couldn't move your wrist. But you never think about the past 5, 10, 20 years of usage. You only think about, did I do something wrong yesterday? Did I lift weight wrong, or did I do something too much? So today I'm going to show you some of the things you can do that might help release some of the tension in the elbow, tendon, and the wrist. But ultimately, you have to seek a chiropractor who work on extremity so that they can address the muscle, the tension of the tendon, and then the physical therapy, but then also adjust the wrist. One of the things that we can do now is always make sure you have good flexibility. So daily stress of several times a day, if you are typing a lot, is stress out the forearm extensor. So when you actually put your hand like that, you can feel the tension right here. Or you can put both hands on the wall like so and just push them in like this. Okay, so I'm going to stand up and show you guys. So one way of stretch out the wrist is this way, or you can also turn this way to stretch out the hip, the flexor on the arm. And you see your wrist is you moving up this way, you use this muscle here. We call that extensor. And then you flex your wrist this way, it's called the wrist flexor. Okay, and your joint get nutrient by moving all the joint to its max range of motions. So stretching these out will help reduce aging and help your joint become stiff. But to get rid of the lactic acid in these joints, stretching is not enough. You need to have either a chiropractor, acupuncturists, cuppings, massage, ultrasounds, laser treatment, whatever way it is, to stimulate the increase of circulation inside the muscle so that your body can help neutralize the lactic acid buildup. And also nutrition. If your body doesn't have enough electrolyte, like say calcium, magnesium, and potassium, the muscle tightness will not be dissolved. I'll show you one more exercise you can do to stress out your forearm and your wrist. Is put your hand like this, grab the wrist, like so, turn it inside, and then straighten them out and lock them up like this. And you can feel the whole stretching, pulling from here all the way down. Just make sure you do this for at least 45 seconds to a minute and do it 3 times. There you go, do it 3 reps, repeat it 3 times. And do that at least a couple times a day. So the important thing is, if you have wrist pain, seek a doctor for professional help. The brace help while you're healing, but if you wear the brace too long, your muscle atrophy and the problem is a lot worse. All right, so remember, this video is all about you guys. I make this video for you. So if you have any questions or any ergonomics, any profession that you want me to tag it on and talk about, discuss on this channel, please feel free to drop me a comments or critique or questions for that matter, and then we'll make sure we respond as soon as possible. And also, like I said, it's all about you guys. So I hope this benefit you. So whatever comment you can give, I'm more than happy to respond to it.